Okay, so we're back from doing our scalp cleansing. So we went in and we washed the scalp skin with our scalp cleanser. First time round you need to use at least 20-cent piece of the scalp cleanser between two hands and all over the scalp. Now it won't foam the first time round because the scalp is dirty because we've just done brush therapy. So we rinse it off and we actually do it again. Second time round you need about a 10-cent piece. Some people need to do it 3 or 4 times. The key with the scalp cleanser is that you actually keep using it until it foams. Now we don't run the scalp cleanser through long hair. This hair here is chemically treated, it's coloured, and it's not growing properly. So there's no way I would put a scalp cleanser through that hair. So we just keep it 10 to 15 centimetres from the scalp. So we rinse our scalp cleanser out, and then we go in with our scalp tonic. Now a scalp tonic, as we said before, is about opening the hair follicle. So this preparation is all about cleaning the scalp skin so it can take on some treatment and getting the treatment down to the hair bowl, which is underneath the scalp. So the scalp tonic gets applied directly to the scalp because it is a liquid gel. So you must always give it a good shake and you just press a little flip top and then we apply it to the scalp. Now it feels like a scalp freeze. So you can actually feel it as soon as it hits your scalp. You spread the gel all around the scalp. You feel where it is, instant acting, rinse it off. Whilst your scalp is freezing, we need to move fast because we're going to get the treatment onto the scalp while it's freezing. So we quickly go in and we look after the hair. Now I've chosen a volume creme because we've actually got quite fine hair even though there's a lot of it. We want to have more volume, and it's a creme and cheveux long. So it's actually going to look after the lengths of the hair and the fact that it is chemically treated. Now our hair shampoo stays off the scalp, so it's 10 to 15 centimetres off the scalp and just through here. Now the hair is clean because we've cleaned it with scalp cleanser, so one shampoo is to soften the hair and then we rinse it straight out. And straight after that we go in with our conditioner. Conditioner for this kind of hair, I go structure because I want to help to mend the hair, but I also want to soften it at the same time. Instant acting conditioner, probably need about a 10-cent piece, mid-lengths and ends off the scalp. Your scalp does not have a cuticle. Conditioner is about closing the cuticle. So then you come through and you're going to towel dry. So we want to stop the hair from dripping, but we want to move very fast while the scalp is still freezing to our next step. So the next step that we're going to use is our microneedle therapy. So here's our microneedle. It comes in its little case. So I always suggest when you open it from the tail end and keep it on a nice firm surface because you certainly don't want to open it up here and then have it dropping through. So we take the microneedle out of the case, and what we're going to do is some channeling on the scalp so we can actually get some topical treatments through. So I generally start doing my microneedle therapy in the middle, and we're just sharing that we're doing some treatment for female pattern thinning here. So the HomeCare for my client is the female pattern thinning area. Now female pattern thinning generally goes no more than 10-15 centimetres back from the beginning of the head and a little triangle down to the ear. So our treatment area for home is finger width 10 to 15 centimetres back and a little triangle down ear to ear. So I'm going to start on this side, so you might want to come in a bit closer to see what I'm doing. We start in the middle and you hold the hair out of the way and you apply the microneedle to the skin because we're channeling on the skin. So as you see, you need to hold the hair out of the way. So you just want little motions backwards and forwards. And you want to go up and down that pathway 3 to 4 times. And then we take about a 1 centimetre section of hair and you just repeat. So up and down, that's 2, that's 3, that's 4. So it's very quick action. Again, we want to get these channels open on the surface of the skin whilst the scalp is still clean and the follicle is open from the tonic. So we move very, very fast. This is so easy to do yourself at home. Of course, I'm demonstrating, so it looks easy for me, but I always get my client to have a go. And anyone who's using any topicals here at our hair health clinic must use the microneedle. Through the sides, it's a little bit more tender because we don't have as much adipose fat tissue around the side of the skull there, so you can take slightly bigger sections and it might make your eyes water a little bit. You're okay there?
Yeah.
Beautiful. I do this to myself, so I know what it feels like. You don't want to create too much pressure. We certainly don't want to cause any bleeding, but we certainly can see that the scalp has a nice flush over it. And we come back and we do our other side. So you can see there it's 2, and that's 3 and 4. Now I suggest you use this procedure every time you wash your hair if we are doing treatment for hair loss and hair thinning kind of problems. So that may be every day for you, maybe every second day, every third day, but certainly in treatment at least 2 to 3 times a week for accuracy. And then up in the side, just go up on an angle. And you can see with me that the skin is nice blush colour, and that's our microneedle therapy done. And once you finish with your microneedle, always back in the cradle and pop the lid on. If you do need to put your microneedle down in between the treatment, make sure it's on a towel, not on a hard surface. The needles will go blunt. Only you can use the microneedle, do not share it, and always seal it. Now for my clients doing in-clinic treatment, bring your microneedle with you because we're going to use this all over your scalp. I don't suggest you do that at home because you're going to get caught up in the hair. So this is why we teach you to focus in your treatment area. So we're going to get ready to use the Activance now. So we'll say goodbye and we'll be right back.